It's a rare cancer that's often hard to detect. Coming up, more on peritoneal cancer and its symptoms. It's a cancer that develops in the thin layer of tissue that covers the abdomen on surfaces like organs, the appendix, stomach, or intestines. Marty Salt introduces us to one man who says he owes his survival not only to a surgeon, but in a rare coincidence, a colleague who knew exactly what to look for.
71-year-old Bob Haas runs a thriving construction company. 3 years ago, this father of 6 and grandfather of 14 started feeling off.
I was having trouble keeping food down. And, looking back at it, my stomach was distended.
Haas ignored those symptoms until his office manager, Teresa, insisted he see her specialists. Teresa had just finished treatment for peritoneal cancer and recognized some of the subtle symptoms, like abdominal discomfort, feeling full even after a snack, loss of appetite, and nausea. Haas says most of his family was in the room when the doctor delivered a devastating diagnosis. Haas had peritoneal cancer.
He says, your husband, your dad, in my estimation, has less than 2 weeks to live if we don't do this surgery.
You need to be very meticulous with your technique not to injure the structures where the tumor grows. It grows right on the surface.
Dr. Gushchin performed 2 surgeries 6 months apart to remove the tumors and treated Robert with Hipec, a form of hot chemotherapy delivered into his abdominal cavity. 2 years later, Bob is cancer-free.
And we do the walk every year.
Bob fields a team with his nickname, Buff Bob, to raise money for research and awareness of peritoneal cancer.
I have to thank Teresa for putting me in the position for Dr. Gushchin to save my life.
This year and for all the holidays to come, I'm Marty Salt reporting.
And doctors say this cancer is often confused with stomach or intestinal cancer, but it's not the same thing.